So today I'm going to show you how to do blood pressures as well as the other different kind of observations we do on our patients. So when you are in the hospital, you'll be doing this quite routinely, normally at least once a day on each patient, if not up to 4 or 5 times a day, depending on the patient's situation. Sometimes they will increase the number based on their, how well they are or how unwell they are, and it's a fairly straightforward procedure that you guys can do. One of the things you've got to be mindful of, course, is infection control. Make sure you use the 7 steps of hand hygiene. Make sure your equipment is clean and calibrated and ready for use. So on each of these devices, they have a calibration to make sure they've been checked in the last 2 years. Make sure that they're not cracked or show any signs of wear and tear. And obviously, at this point, we would have our clean hands. So I'm going to approach the patient. I'm going to introduce myself. You've got to make sure you're communicating very clearly who you are and why you're doing the observations, and then making sure the patient's happy to have the observations done. Okay. So obviously we're plugged in today, so I'm going to go over to my patient and I'm going to say, hi there, I'm Alex. I'm the healthcare assistant on today, and I've come to take some physiological measurements, if that's okay. Just going to check your blood pressure, check your saturations, and check your pulse rate. Is that all right? Lovely. So obviously, Millie's my patient. Sometimes I need to make sure I've got the right patient, so I would do an ID check. They'd wear a wristband, so I'd check their wristbands as well. All right, so first things first, we make sure that we have the right size cuff for the patient. They come in different sizes. This is a adult, so I'm going to check for a pulse first. If you can just turn your wrist. Now you have a pulse here, okay? This is your brachial pulse, so if you can't feel it, try and feel it on yourself. It's a very difficult one to feel sometimes. You're going to follow up to here, and you're looking for around about this area, more than this area. You're not using your thumb. Your thumb's got its own pulse. You're going to use those 3 fingers as a preference, or 2 fingers. Once you've found the pulse, that's your artery index marker. Your pulse is the closest point for your artery in that location. Okay, you've got a pulse here, that's your radial pulse. And you've got a carotid, and you've got your femoral pulses. So the artery index marker goes where you felt the pulse. This goes around. And what you're hoping is that the artery index marker is between these 2 lines to make sure you're in the right spot and you've got the right size. The machine gets turned on for this one that has battery life on it. Always make sure the patient's comfortable and that they're aware that it could get tight. Nearly every single patient you'll ever come across will have had a blood pressure done at some point. These machines can be a bit temperamental and it can overinflate sometimes. So this is then going to go on the patient's opposite finger, and you're going to check to make sure there's no nail varnish and that there's good capillary refill. She's got a little bit of nail varnish on today. It's quite worn out though, need them redone. But basically that you should be able to get a good reading though anyway. It's taking a bit longer to load, but we'll get there eventually. So this machine, there's a start button here. This will start the blood pressure. So you say to the patient, it's going to get a bit tight now, shouldn't take you very long. So this is just going up now, Millie. Hoping it's going to do this really effectively. Sometimes they can be a bit tricky. If it starts to do lots of crackling and overinflate, you've got to be very careful. It can get very painful for the patient. Stop it. Take it off and maybe get a different size cuff, or make sure that you're in the right location. It's normally a little bit faster than this one. Oh, it's done it already. No, I've just pressed the wrong button. 102.65, okay? So I'm going to take that off your arm now, Millie. Always take it off when you've got the result, because they are very sweaty and sticky and they're not very comfortable. So do make sure that you take it off as quickly as you can. It should be as quick as that. If it takes a bit longer, there's normally 2 reasons. One is the cuff isn't the right size. The other one is you haven't got it in the right location for the pulse. So 102/65. Now, we've taught a lot about blood pressures and what's normal. We know that that's on the slightly lower end of the spectrum than we'd normally like. Normal range is 120/70. There are many reasons why a patient may have that lower number. A younger person, younger female particularly, will always have quite a low blood pressure anyway. If it's very, very low, if it's below sort of 80 on that top number, that's when we're really worried about our patients, okay? The other thing I did is I put a finger probe on. That's measuring the oxygen levels in the, on the hemoglobin, okay? So 100% of her hemoglobin is carrying oxygen right now. All right, so this is indicated that she's well oxygenated and that she's not going to have any issues with the respiratory or any issues around oxygenation, okay? So we're pretty happy with that, 100%. You would normally document this on a chart, or you would document it on a vital pack system at the hospital, okay? They use their own system. 100% is what we're looking for on that one. Otherwise, we're looking at 94 to 98 as a general rule.